Hello everyone! In this lesson, we will learn about on-site first aid for fires and explosions involving hazardous chemicals. Let's begin with fires. Flammable gases, flammable liquids, flammable solids, and substances that ignite upon contact with water, classified as hazardous chemicals, can all potentially catch fire under certain conditions. When handling any hazardous chemical fire, the principle of control first, extinguish later should always be followed. The following is the fire accident response procedure. 1. On-site assessment and safety protection. 1. Quickly identify the hazard source. Determine the type of chemical. Identify the chemical properties by observing container labels, safety signs, flame color, and smoke characteristics. For example, burning yellow phosphorus emits white smoke, while burning sodium produces a yellow flame. Assess the level of risk. Check for signs of pressure vessel heating, gas leaks, or runaway reactions. Evaluate the risk of explosion and toxicity. Establish a safety zone. Based on the fire size and chemical properties, set up a safety perimeter of at least 50 to 100 meters. Evacuate all non-essential personnel. 2. Ensure proper personal protection. Wear protective gear. In the early stages of a fire, wear fire-resistant clothing, a self-contained breathing apparatus (SCBA), chemical-resistant gloves, and fire-resistant boots. If corrosive chemicals are involved, wear Class A chemical protective suits. Team collaboration. Enter the fire scene in teams of at least 3 people. Assign specific roles for firefighting, rescue, and communication. Designate a safety observer to monitor environmental changes. 2. Fire control and extinguishing. 1. Cut off the fire and leak sources. Close valves and isolate unburned hazardous materials. Shut down power sources to prevent reignition from electrical sparks. For flowing fires, create barriers or drainage channels to prevent the fire from spreading to other areas. 2. Select the appropriate extinguishing method. General principle: use dry powder or carbon dioxide extinguishers as the first choice. Prohibited use of water. Do not use water on fires involving sodium, potassium, calcium carbide, and concentrated sulfuric acid. Specialized chemical fire extinguishing methods. For fires involving oil, use foam extinguishers. For fires involving lithium batteries, use large amounts of water for cooling. For fires involving metals, use Class D extinguishers or cover with dry sand. 3. Control toxic smoke. Use water mist to dilute toxic gases, but avoid direct contact of water with certain chemicals. Stand upwind and use ventilation fans to disperse smoke. 3. Rescue and first aid for the injured. 1. Quickly evacuate from the fire scene. Wrap the injured person's body with a fire-resistant blanket and drag them to a safe area. Avoid carrying them on your back to prevent worsening inhalation injuries. If the victim's clothing catches fire, immediately cover them with a fire-resistant blanket to extinguish the flames. Or instruct the victim to stop, drop, and roll. 2. Assess the injuries. Burn severity. Determine whether the injury is classified as mild, moderate, or severe burns. Redness and swelling of the skin with pain but no blisters is classified as mild. The presence of blisters, skin peeling, and intense pain indicates moderate severity. Charred skin, shock, or associated respiratory burns are categorized as severe. Inhalation injury. Check for signs such as black soot around the mouth and nose, hoarseness, or difficulty breathing. These symptoms suggest the possibility of airway burns. 3. Targeted first aid measures. Burn treatment. Rinse the burned area with cool running water for 10 to 15 minutes. For chemical burns, rinse for at least 30 minutes. Carefully cut away and remove burned clothing to avoid tearing adhered skin. Cover the affected area with sterile gauze or clean cloth. Do not apply ointments, toothpaste, or any home remedies. Inhalation injury. Keep the injured person in a semi-recumbent position. If available, administer pure oxygen. If airway obstruction due to throat swelling occurs, a trained professional should immediately perform a cricothyroid membrane puncture or tracheotomy. CPR. If the victim has stopped breathing or has no heartbeat, begin CPR immediately. Avoid mouth-to-mouth resuscitation to prevent inhaling toxic gases. 4. Handling special scenarios. 1. Fires involving explosives or pressure vessels. Immediately evacuate to a blast shelter or a safe area. Wait for a professional explosives disposal team to handle the situation. If action is required, use a remote-controlled water cannon to cool the tank and prevent a physical explosion. 2. Toxic gas leaks with fire. Wear positive pressure breathing apparatus as a priority. Use a water spray curtain to contain and block the spread of toxic gas. After moving the injured person to a safe area, quickly remove contaminated clothing. Wash exposed skin thoroughly with clean water. 5. Transport and handover of injured persons. 1. Preparation before transport. Continuously monitor the injured person's breathing, pulse, and blood oxygen saturation to track vital signs. Record key information, including name of the chemical involved, duration of exposure, and first aid measures already taken. 2. Transport requirements. Use a stretcher to stabilize the injured person. Keep the injured person in a side-lying position. Contact the hospital in advance to activate the emergency treatment fast track for burns or poisoning cases. 6. Site cleanup and decontamination. 1. Completely extinguish any remaining fire and check for the possibility of reignition. Use absorbents such as sand or vermiculite to manage residual spills and store them according to hazardous waste regulations. Rescue personnel who entered the site should undergo decontamination at a pre-established decontamination station. Wear protective suits and use specialized decontamination equipment for washing. After removing protective equipment, perform secondary decontamination, focusing on sensitive areas such as the mouth, nose, and eyes. Next, let's learn about explosions. When flammable and explosive hazardous chemicals are exposed to high temperature and high pressure conditions, explosions can occur. In addition to the injuries caused by high temperatures, explosions also produce projectiles and shock waves that can pose significant health risks to individuals. Explosions often cause multiple injuries throughout the body. During rescue operations, it is essential to quickly assess the injured areas, determine the severity of the injuries, and prioritize treatment for damage to the heart, brain, lungs, and blood vessels. After an explosion occurs, the following targeted first aid measures should be taken. 1. Management of blast injuries. Traumatic brain injury. Use a cervical collar or a rigid splint to stabilize the head and cervical spine. Place the injured person in a side-lying position to prevent aspiration of vomit. Check if both pupils are dilated and record the Glasgow Coma Scale (GCS) score. Internal bleeding. Do not allow the injured person to drink or eat. Use an abdominal bandage to apply light pressure to the abdomen to reduce bleeding. For suspected splenic rupture, keep the person in a left side-lying position. For liver injuries, place the person in a right side-lying position. Tympanic membrane perforation. Clean any foreign objects from the external ear canal. Cover the affected ear with sterile gauze. Do not pack or rinse the ear canal. 2. Management of combined burns. Chemical burns. For strong acid or strong alkali burns, rinse the affected area continuously with copious amounts of water for 30 minutes. For hydrofluoric acid burns, apply calcium gluconate gel after rinsing. Specific chemical burns. Phosphorus burns. Cover the wound with a wet cloth to isolate it from the air, or gently wipe the affected area with a 1% copper sulfate solution. Phenol burns. First wipe the affected area with 50% alcohol, then rinse thoroughly with clean water. Thermal burns. Cut away burned clothing carefully without tearing any fabric adhered to the skin. Rinse the affected area with cold water for 10 minutes. Cover the wound with sterile dressing. For large area burns, use plastic wrap to prevent contamination. 3. Trauma and bleeding control. Major arterial bleeding, direct pressure hemostasis. Fold gauze into a 5 cm thick pad and press it directly on the bleeding site. Apply a spiral bandage to maintain pressure. Tourniquet use. For upper limb bleeding, apply the tourniquet to the upper third of the upper arm. For lower limb bleeding, apply the tourniquet at the base of the thigh. Record the time of application and release it every 1 hour. Open pneumothorax. Immediately seal the wound with Vaseline gauze or plastic film. Secure 3 sides with tape, leaving one side open for air to escape. 4. Poisoning and inhalation injuries. Toxic gas inhalation. Move the injured person to an upwind area. Loosen clothing around the neck to aid breathing. If the person is unconscious, use a nasopharyngeal airway to maintain an open airway. Carbon monoxide poisoning. Provide pure oxygen immediately. Cyanide poisoning. Administer amyl nitrite through inhalation. Dust asphyxiation. Clear dust from the mouth and nose. Use a bag mask ventilation device to support breathing. Avoid mouth-to-mouth resuscitation. The on-site assessment and safety protection for explosion accidents, as well as the transfer and handover of injured persons and site cleanup and decontamination, align with the procedures for fire accidents. Alright, that concludes this lesson. In the next lecture, we will cover first aid measures for chemical poisoning and asphyxiation accidents and chemical burns. See you next time.